Hello dear patients and our followers, I'm Dr. Ahmedov, hair transplant surgeon from Smile Hair Clinic, Istanbul, Turkey. Today we are going to discuss a specific case of our patient Marek, a 29-year-old male who underwent a hair transplantation surgery in our clinic almost 1 year ago in January of 2025. What makes his case stand out of the many of the cases we share with you is that he unfortunately had a traffic accident with the burn trauma to the facial part of the face, to the skin of the head, and the hair part of the scalp as well. So it was the reconstruction case. That's one of the most challenging cases we face throughout our career. Before coming to our clinic, he had multiple plastic surgeries to do the reconstruction of the facial part, reconstruction of the skin of the head, and facial parts. Before coming for the surgery, here you can see his picture before the surgery. Basically, you can clearly see the scar tissues all across the forehead, in the front forelock and front third part of the head. Also, there is a burn trauma and scar tissue on both temple peaks, on the facial part, one part of the mustache and the left eyebrow side. So these type of surgeries are called the reconstructive surgeries on the scar tissue. Scar tissue is always more complicated and more challenging cases in our career or the hair transplantation surgery. Why? As a general rule, the scar tissue always lacks the blood flow that is usually seen in normal skin. So simply speaking, there is a less blood flow in this type of skin. So when you do the surgery and do the implantation, the survival rate of the grafts in this type of the tissues are always slightly more diminished compared to the regular skin. Alongside with this scar tissue property, there is also one problem, as we call the connective tissue underneath the skin, or the kind of cushion of the fat pad that keeps this area strong. In this type of advanced type of the trauma, this fat pad, sometimes we call it this way, can also be affected. And unfortunately, in the Marek case, it was this way. The skin was very thin, the connective tissue was very thin, so the skin was almost attached to the bony structures of the scalp. Here you can see the pre-operative planning of the surgery, the hairline that we designed for him. The hairline we try to keep is always, as a general rule, we try to keep it conservative, so we'll be able to give the patient more coverage and the density instead of just lowering the areas and restore the hairline completely like in their 20s. The challenging part of this surgery, but before this type of surgeries, we sometimes do a control implantation of the hair in smaller areas just to see how the survival rate of the grafts will go. It's specifically very important with the advanced types of the traumas that Marek had. So he had one small minor transplant surgery to see how the survival rate of the grafts will go. So the survival rates were more or less in a good level, so we decided to proceed with the more advanced type of the surgery. But before the surgery started or even planned it, we planned the surgery almost 6 to 9 months before the actual surgery. He had a couple of sessions of the PRP treatment. PRP is a kind of reinforcement to the skin of the head to make the blood flow in this area better, or to push the areas to generate some small blood vessels. We call it neovascularization, and help these areas to save or keep the hair much better condition. So the pre-operative planning was done. He had a couple of sessions of the PRP before the surgery, then he came for the surgery. So this is the initial plan for the surgery. You can see very clearly the burn scars across the forehead, as we mentioned, in the front area, the temple peaks, the facial part of the Marek. So we went with the conservative hairline, meaning that it starts as high as possible, the corners slightly more elevated, so we'll be able to give the patient more coverage and the density. The areas, the trauma areas that will be transplanted were marked carefully, and the calculation of the area in centimeter squares were done. The Marek had a combined surgery of the hairline restoration, temple peak restoration, and front third restoration, plus adjustment of the left eyebrow. This is the scar tissue. So he was initial planned for two-step surgery. The first one will be the front side and the eyebrow, and with the second surgery in the future, we'll be planning to do the covering of the crown area where the scar tissue also exists, and also one part of the face in the mustache area. So alongside with this trauma case, there is one more thing, is that Marek also has some features of the classic androgenetic alopecia. So it makes his case slightly more challenging, and just because he has some features of the androgenetic alopecia, He was also prescribed for finasteride minoxidil treatment to slow down or delay the active hair loss as much as possible. So here you can see the temple peak reconstruction, the first surgery survival areas, and the marks. The planning was mainly the front area and the front mid-scalp, temple peaks, and the left eyebrow. The Marek was transplanted 3,500 grafts. Out of this number, 2,900 grafts were implanted in the front area, 550 were implanted in the mid-scalp, and we had around 50 grafts implanted in the left eyebrow of the Marek. So here you can see him before the surgery. This is the incision part of the surgery. And one of the challenging points about this surgery on the scar tissue, because as we mentioned earlier, the blood flow here is lower and the skin is thinner, these patients tend to have a higher risk, or they may be more prone to developing skin ischemia and necrosis. That's why we cannot go with the very high density implantation. The aim of the surgery is just to restore the front frame of the face, make a medium density distribution of the grafts so the patient has a more or less even outlook of the hair. The aim is never to get him back to his 20s, that's number one. And if needed, after this one, the patient may have one more surgery to do some more densification, but for most of the patients, even the medium density coverage with a good angle and direction should be perfect enough to meet their basic expectations. The most important here is the direction of the incisions. You can see they turns, the corners, they should match the actual direction of his own hair, and we try to mimic it as much as possible. But of course, due to some distortion of the skin, in some areas it was slightly tougher, but in general we were able to acquire his natural direction of the hair. This is him immediately after the hair transplantation surgery, and you can see the transplant area mainly in the front side, the temple peaks, and also the left eyebrow transplantation. In some areas in the temple peaks where the scar tissue was the thinnest, he had the previous surgery, but because we tend to place the grafts in a more conservative way, the grafts in this area were removed. That's the kind of surgeries we do every once in a while. We call it the reversal surgery. Sometimes the patient may not want the hair that were implanted previous surgery to stay the same way, so we can just remove them and reimplant it to the back. We did it for this patient as well. Otherwise, we would have to get the hairline too much forward, and it would mean for him to use higher number of the grafts. We didn't want to go like too aggressive in his case for the first surgery. This is Marek's case immediately 1 month after the surgery. You can see the transplanted area is in a good condition, the healing is completed. You can see some skin discoloration is perfectly normal. You can see the donor area, he had some degree of the thinning at the back of the head, but because the scar is really new, it's almost only 1 month after the surgery. That's a perfectly normal view immediately after the surgery. And this is the Marek's case 6 months after the surgery. 6 months is a key point for us. That's the time frame when we see the initial results. It's around like 30 up to maybe 50% of the first results. When we do the hair transplantation surgery isn't like an immediate result surgery. So when we do the surgery, most of the time we get the questions from our patients saying when we are going to see the results. The initial results for the surgery take around 5 to 6 months. It's around 30 to 40, maybe up to the 50% of the final results. Good results for the patients on most of the time take around 1 year. It's around 80 to 85% of the results, and final results may take up to 18 months, especially for the crown area that may be slightly more delayed with the growth and maturation of the hair follicles. But even at this point, you can see it's already a life-changing surgery for him. We have restored the front frame of the face. That's one of the most important things for us, because that's our identity. That's the line that separates our forehead from the skin of the head, from our main identity. The temple peaks were restored, the front area is covered. So we already restored his identity with his facial hairline. And also you can see the donor area is already in a good condition. The recovery has gone well. The maturation of the scar tissue is ongoing, and he's in a much better condition than it was immediately after the surgery, 1 month. And this is Marek's case 9 months after the surgery. You can see the hair maturated even more. The front area is covered, the temple peaks restored, the donor area healed almost completely, and it's in a good condition. The progress is ongoing, and day by day it's getting better and better. And that's how the life-changing surgery goes basically. And that's one of the cases we already made us as a clinic proud as well, because it meant too much for this patient. It's completely changed his life. This is him before the surgery, after the serious trauma, serious accident, and very tough days. Now he's in a much better condition. His self-confidence is restored. He's happy. He's happy, we are happy, and hopefully everything will work even better for him after this point. Most probably we'll be seeing Marek for his second surgery whenever he feels himself ready to adjust a little bit to the crown area and maybe to restore the other side of the mustache. Personal case. So this is the story of the patient with the specific case of the surgery over the scar tissue, burns tissue, whatever call it, but generally term it as a scar tissue. So in scar tissue, as we mentioned earlier, it should be evaluated really precisely. The extent of the damage, the vascularization of the skin, the thickness of the skin or pattern, some pre-operative preparations, maybe some control implantation in the scar tissue should be done. It's not only the surgery when you come and say, hey, let's do this surgery immediately. No, it requires a pretty much of expertise, knowledge of the skin features, physiology and anatomy of the scalp after the serious traumas, and the working on the scar tissue is always challenging. Thanks for watching, guys. Stay tuned. If you have any questions, you can always leave the comments below the video. We'll be glad and happy to answer them. Stay tuned and good luck.